Amanda, thank you so much for that generous introduction. I should clarify that I was dean while Amanda was a student, so I worked with her. I was dean for 13 years. She didn't take 13 years to finish. So she was much ahead of her time, and great to see you, Amanda, and to be here with my colleague and friend Mirta Rosas. It's a pleasure to see you here. I was saying before, that she now is coming to the culminating period of her leadership of PAHO, such an important period for the organization, where we've all admired her. And I was thinking, well, now that she will finish, will she be even more outspoken than she was while she was in? And I don't think that's possible. So I know we're going to hear the straight truth from Mirta as she speaks also today. And I was thrilled to be here because this is a topic, this is a subject on the use of resources and to use them efficiently that has occupied and preoccupied me since the time I really began to work in the area of health policy, which is decades ago. Indeed, it was in the early 70s when the idea of health technology assessment as a defined concept and field really began to take shape. People started to think of what they were doing in this area as evaluating technology, not just thinking about programs and use of services, but also thinking about the tools and how good were those tools. Technology as a concept goes back into the 19th century, and the idea of technology is very simple. It's knowledge applied to a purpose. That's a simple definition. But in healthcare, we draw on a lot of knowledge and we have many, many different purposes. And the question for us always in healthcare is, are we using that knowledge in a way that truly advances health? We at the Institute of Medicine had a recent study called Best Care at Lower Cost. And the committee that worked on this did an honest look at what's happening in the US healthcare system, and their assessment was that there every year are $750 billion, more or less, spent without contributing to better health. Lots of reasons we could discuss that go into this. Underinvestment in prevention, which is so important and so often invisible, and therefore not capturing the resources that it needs. Misuse of technology and underuse of necessary technology, overuse of other technologies, the slow development of needed technologies, the failure of our regulatory system to detect early enough unsafe technologies. And so when we think about the whole array of organizational, social, healthcare, epidemiologic forces that affect the cost of healthcare, it's hard to know sometimes where do you begin? Where do you get a handle on them? Every country, no matter how wealthy or how impoverished, cannot afford to waste money in healthcare on health technology that does not contribute to health. The harder question is, how do we as a society and every country individually come to grips with the questions of what technologies, how much technology, what kind of technology, deployed in what ways? What does make sense for us in our country? What do we really want from technology in health? First, we want it to work. We want it to be effective in improving health. Second, we want it to be safe. We want it not to cause unnecessary harm. We may be prepared to take informed and knowing risk in order to gain benefit. Oftentimes the two go together. But we don't want to take unnecessary risk, and we don't want to take excessive risk relative to the possible benefit. We want technology that's going to be affordable both to the individual user and affordable to the society. And those two are not always identical. We want technology that's going to be acceptable to those who deploy it, to those who regulate it, to those who receive it, to those who are either the beneficiaries or suffer the consequences of technology. And we want the technology to be deployed in an equitable way. We want it to reach the people who need it and would benefit from it. We want to be consistent in the way we make decisions about technology. So if you say, okay, you've got 8 or so desiderata, desired qualities. You want it to be effective, you want it to be safe, you want it to be affordable both to the individual and to society. You want it to be equitably distributed. You want it to be known in terms of its safety. You want it to be evaluated, and you want it to be deployed in a way that really reaches the people who need it. I can tell you my own, I will say without fear of contradiction, every country, every health system has room for improvement. Everybody can do better than we are currently doing if those are our goals with what we want to accomplish with technology. Countries have different approaches to the large problem. Some countries say, we'll ignore the problem. Another way of saying that is we're going to let the pure market decide what gets used, by whom, and how. Sometimes countries do that even for technologies that you might think have a moral connection. For example, transplantation organs. Countries differ in how they regard a market, in quotes, for organ transplantation. Some countries say, we are going to regulate comprehensively and decide before any technology is deployed. So they would have an approach which says, we need to look at the effects. We need to understand more comprehensively the risk profile. We need to be able to judge how much this is going to cost and what benefits it's going to produce. So we have approaches, for example, where some countries will take expensive technologies, high-yield technologies, and put them through a required process before decisions will be made either on payment or use. For example, you have NICE, as it's called, the National Institute for Comparative Effectiveness in the UK. You have systems in Australia, which number altogether at least 4 agencies that I'm aware of that look at technology assessment in different guises and ways. And I know we're going to hear a number of examples from the PAHO region of the way countries undertake to approach this question. And do they have a pure market? Do they have a complex regulatory? Do they have some form of regulated distribution? Do they have controls over the nature and types of uses? So thinking about what do we have to learn from one another in the way we approach technology, what we try to achieve with it, how we approach it from a comparative effectiveness point of view, from a deployment point of view, from a payment point of view, from an evaluative point of view. On every dimension, I would submit we have a lot to learn from one another and a lot to learn in our own approaches. Now, let me mention just 2 aspects of evaluation that I think are very troubling, very complicated, and very difficult to come to grips with, that we don't, I think, yet as a community of, let us say, scholars looking at the problem, or regulators dealing with the problem, or countries making policy about the problem, that we don't really do extremely well at. The first problem is this. If you think about technology and how well it works, certain aspects of its performance are universal. That is, it's dependent on human biology, which is the same no matter whether you're in a rich country or a poor country, which is the same no matter whether you are, let us say, middle-aged or very young, oftentimes. But there are differences, especially across countries, in the distribution of diseases and the nature of risks, in affordability and ability to pay. And the implications of that, if you believe that all of these elements need to enter into a decision about a technology, is that what may be the right decision for country A is not necessarily the right decision for country B. And the implication of that is that we cannot take completely on face value what any other country decides without interpreting it within your own lens and your own situation. And there are cases, I would say, an example that I think is a very difficult example, fortunately no longer as relevant, with rotavirus vaccine. To take an example, here was a vaccine that prevented a very prominent diarrheal disease in children, in infants in particular, that would reduce mortality, but had a side effect of intussusception, which could be dangerous, especially if you could not hospitalize and take care of children who suffered this very rare but still very serious side effect. That early vaccine was removed from the market for a number of years. Now we have safer rotavirus vaccines. They're available, they're being used. But in this interval, when no one had access to it, there's no doubt in my mind that countries where it could have been deployed with net benefit, saving lives, refrained from doing it because it was not approved in every country and was deemed to be inappropriate. And then the manufacturers, of course, lost interest in manufacturing it because no one was going to use it. And we have to ask ourselves, was this really a rational choice that we each made in terms of what was right for our populations at a given moment in time with a given disease distribution, a given risk profile? So we cannot take what others say as right. The flip side of that, of course, is we do want to learn from one another's efforts to evaluate. So learn from it, but don't just take it whole at face value. The second problem, the second dilemma, is that technology which may be exactly appropriate for some subset of patients, when approved, available, paid for, very often is going to be deployed very differently than just in those for whom it would actually offer benefit. So what is the combination of education, regulation, professionalism, understanding of the effects of what we do that not only gets us the available technologies, but the right technologies used in the right patient, in the right way, at the right time, and no more? So these two problems of the adaptability of evaluation from one country to another, and its applicability, what we learn from and what we should not learn from one another, and how to manage technology beyond its gross approval or non-approval to affect and influence how it should be properly used within a health system. Those are really critical core challenges that are in front of all of us. So I'm thrilled to see that this theme of evaluation and technology is coming more and more to the fore. It's very exciting to learn about the initiatives that are being taken in many countries, and particularly in the PAHO region around technology assessment. And it's very important for all of us to simultaneously have the open mind to learn from one another, but also the determination to make the right decisions for our own populations every time. Thank you very much for having the chance to be here.